of our weekly webinar series, and today's webinar continues as part of this Incident Management System series. So thank you all for rejoining us if you've been on these webinars before, and welcome to anybody that's joined us for the first time. We're really looking forward, obviously, to continuing this engagement with everyone through these informative webinars. So a quick update to say that translation services are available today, and in order to access these, you click on the translation button in your Zoom menu, and that will give you the option for the translation services that are available. So throughout the webinar, we've got two presentations today, and you can submit questions or comments in the Q&A section, again, located in your Zoom menu. And we'll be happy to address these at the end of each presentation, where we'll do a short Q&A portion to follow each presentation. If you've not already done so, we'd also really encourage Discord platform. This is for continuous engagement with our experts and professional colleagues, and we'll post the link to the Discord. It's available on the flyer for this webinar, but also we'll post the link in the chat box shortly. So the community of practice is about learning, and so it's not just learning from the presenters at these webinars, but also from each other. So we'd like to really encourage everybody to sign up to Discord. It's got access to all the materials from previous webinars that we've had, and there's also areas for chat and posting questions. So as part of our ongoing evaluation and our continued improvement of these webinars, after this session, you'll see a pop-up poll for you to fill in about the webinar. So your feedback is really, really important to us and helps us continue to improve these sessions as we go forward. So I'd really encourage everybody to put their comments and feedback on the poll that pops up at the end. So the topic of today's session is about communications officer role as part of the series on this incident management systems. And our first speaker today is Nika Alexander from WHO headquarters in Geneva. Nika works in communications and is going to be talking about the role of the communications officer. So over to you, Nika.
Thank you, Emily. And with your indulgence, I would really be able to do questions throughout. So colleagues, as Emily indicated, if you have questions, please drop them in the chat. I see already that some people have highlighted where you're from. So Dr. Tumuhairwe from Uganda. We have colleague Bayu Begasha from Hungary. So please drop in a few more so that everyone can see where we're all from. That's, I think, will help enrich our discussion. To introduce myself, my name is Nika Alexander. I'm a communications officer with the World Health Organization. I've been with WHO since 2008 when I started in the China office. And I always say that that's an incredible experience because China is so big. You experience many different topics and emergencies. So it was a very good baptism by fire joining WHO. Then I worked on the pandemic. I came to Geneva, WHO headquarters in Geneva, and worked on the 2009 pandemic. Some of you might not even remember we had a pandemic then, but there was a flu pandemic then. Since then, I've worked on cholera in Haiti. There was an earthquake, and then there was cholera. I've worked a lot on Ebola outbreaks. I was in Sierra Leone and Guinea in 2014, and then on the Democratic Republic of the Congo outbreaks in recent years. So I'll be talking a lot about my experience in the incident management system, especially now. I'm the communications focal point in the incident management system for the COVID pandemic here at headquarters. Just before I go on, have a look, colleagues, in the chat. You'll see we have Sao Tome, Nigeria, another colleague from Uganda. It's nice to see you all. Thank you. And please drop in questions. Emily, you can keep an eye on the questions as well and do, put up your hand to ask some questions. Colleagues, by a show of hands, how many of you are communications officers? If you could just put the hands up icon so we can see how many of you are actually communications officers or have a lot of responsibility in the area of communications. Welcome, Kenya and Oman of our participants are communications officers?
Increasing numbers. So we've got about
Yes.
10, a handful of people, 9 to 10 people at the moment. We have 106 attendees on the
Okay.
line at the moment, but maybe people are
Okay.
locating their hands up button.
Sure. Yes, that always takes some time. So just before I start, what do you think we mean? Maybe either colleagues who do communications or others, what do we mean when we say communications? Because it's a very big word. But what do you think we're talking about when we talk about communications in the context of an emergency operations center? Anyone, Emily, you can unmute if you see people who now lower your hands unless you want to speak on this topic. So the question being, what is communications? What do we mean when we're talking about communications in this context today?
So we have 4 hands up. So we have Kogola David Udongo.
Sure, go ahead. You appear to be muted at the moment, David. Kogola David. Still muted. Shall we go for another one and we can come back?
Yeah, let's try. Oh no, go ahead, Kogola.
Yes.
We can hear you. Please go ahead.
I think communication, according to my own explanation, I think it's just a way of expressing yourself from one person to another to help you get whatever, or to get an information and to pass it to other. And
so that's a very broad. That's the broad description of communication. We're talking about communications in the context of an emergency operations center. Perhaps colleagues who do work as communications officers can come in here now and say, what do we mean? What type of communications do we mean when we talk about it in an emergency operations
I think when we talk about communication in emergency, I think it's just a way of expressing yourself or passing information to another person that have not get the information about the emergency. Yes.
Okay, so that's part of it. When we're in an emergency operations center, the role of the communications officer is to manage especially the communications with media and external audiences. So that's different from internal communications. That's different from communications with donors. It's different from IT and telephones, and that can sometimes be called communications as well. But
Yes.
when we're in the context of an emergency operations center, we're talking about the officers who are in charge of managing media queries, of managing certain communication products, and mostly external facing. Another question is, actually we'll come to that in a second. So the reference documents, if you see, we have a few key reference documents that outline what your job is if you're the communications officer in an emergency operations center. And I'll name them, but you can find the links in the notes from this session. So there's the WHO framework for a public health emergency operations center. And there on page 20, it outlines the roles of a communications officer. And that's how I'll structure the next part of this discussion. You can also look in the handbook for developing a public health emergency operations center. Presumably that's another document you're already familiar with. And if you look on page 36, there's some more details on a communications officer. And also the AFRO, Public Health Emergency Operations Center handbook, has several pages of detailed descriptions of the role of a public health emergency, of an officer, a communications officer. I just thought that clarification is important to make off the top, because often, because the word communications is so broad, often people will think everything related to communications, every type of communications must come to the public information officer or the communications focal point within the incident management system, and that's incorrect. Can somebody come in and explain why one person cannot do all of those roles? Perhaps someone who's had the experience of being asked to wear many different hats and why that's a challenge. Would somebody like to speak on that?
We have Bayu Bekele has had his.
Please go ahead, Bayu.
Okay, thank you. I'm glad to talk with you regarding this topic. Just for curiosity, would you repeat the question, please? I can elaborate
Sometimes because the idea of communications is very broad, sometimes communications officers or the public information officer will be asked to wear many different hats, to write situation reports and answer media queries and take meeting notes maybe, and to do donor relations and to work on risk communication and community engagement. Has any of you experienced having to do 4 or 5 or 6 of those jobs at the same time is my question. And why is that difficult? Have you had that experience, Biden?
Sure. Yes, actually, I'm now a PhD student, and before that, I have exposure and experience to work in public health emergency situation in Africa. And yeah, during the emergency period, it's important to include all stakeholders from different perspectives to manage and interact at the same time, at the same point, with the common goal to combat against the emergency or the epidemic. So it's very difficult if you engage a single part or a sole part of the body to take part in this communication. It is impossible for success mitigation of such epidemics. So it's very important to include multi-sectors, multi-stakeholders. Basically, and health is one of the principles needs multi-sectoral collaboration for successful to bring successful health to see or bring successful health impact. So this is my point.
I think you're right, Bayu, but it's also very important to focus that. We're not, every single person in the incident management system cannot engage every single stakeholder. And it's very important that each role be clear, and the communications officer does not engage with all stakeholders, but engages with certain very specific ones. So let's talk a little bit about who you engage with. If you look under the structure, the communications officer is part of management. If you look in the structure of emergency operations centers, communications is put under management. That's because it's an overarching responsibility. It's somebody who has to interact with a lot of different stakeholders, as you said, but it also has to be very focused. So you are communicating. One of the main things a communications officer needs to do is think about, what do we need to communicate externally? What do we need to tell the public through the media about this emergency? I think earlier on, David was mentioning about life-saving information, and that is one of our key roles. You need to communicate the information that people need to know so they can protect their health. They need to know how this emergency is developing, what we know, what we don't know, and when we will have the next updates. That's really the core of our work as communications officers. And in order to do that, we work with many, many different colleagues. We need to learn from the technical colleagues what their understanding is. We need to know from the logistics colleagues, for example, if there's certain products that are coming in that we need to, that people need to be aware of. We need to show that the organization, whoever you're working for, the government or the ministry, is working very hard. You need to express the challenges. So in order to do that, you need to have, as a communications officer, you need to be engaging with a lot of colleagues, but remember that your focus is external towards the public. Now that brings a concern, because it's not the same as community engagement. You are not the community engagement officer, you're the public information officer. Can somebody tell me the difference between a public information officer and the community engagement officer or focal point? And we've had 2 gentlemen, and we would be nice to hear from a lady as well. If there are any women who have this experience, I know there's a lot of women who work in community engagement and communications in general. It's a field that has a lot of women. So if we could have a woman colleague as well, don't be shy. Anyone want to raise your hands? Otherwise, you're all going to hear from Jamila, who's going to come up next, and she will have a lot of detail on this experience.
We have 3 hands up.
Yes.
Bayo has still got his hand up. We have someone that's noted as Galaxy A8 2018, but I don't know who that is. If you are happy to come off mute, and then we can hear from you.
So the question again is, what's the difference between a public information officer and someone who does community engagement work. Alain Blaise, I know you're Alain, I'm sure you're not a woman, but happy to hear from you.
So thank you very much. What I would say is I see the PIO role mainly to be internal to the team. The PIO is like kind of putting the dot together within the team of the response team or the emergency team. And the communication is more external, how to engage external stakeholders depending on what the action is. So the community engagement is more likely to be an action that will decide that we want to do. It's more like operation, but the public information officer, the main role is really within the team to make sure that the information is flowing within the team for the correct and the appropriate action at the right time. Thank you very much.
Thank you for giving us a topic to discuss. I think that's not quite right. And this is precisely why we have a session like this, so that we become more clear. The public information officer, remember the word public is right in there. It is definitely a public facing person. You could almost replace the name with media officer. Sometimes perhaps you're confused by the word information. So it sounds like the public information officer is meant to manage information flow within the team. And that's not right. That would be, sometimes the incident manager has a colleague who works with them on information flow within the team. Sometimes there's a data manager who looks at data products and that flow within the team. But the public information officer, you could almost change the name to media officer. It's the person who communicates with the public about the response. You might not be, the public information officer themselves might not be a spokesperson. It really depends on the setup. It depends on the incident manager's preferences as well. But the public information officers responsible for looking at all of the information that can be shared with the public and how to share that with the public. Should we be doing interviews? Should we be doing press conferences? Should we be issuing press releases? Should we be doing web stories? That's what the public information public information officer is looking at. Somebody who does community engagement are the colleagues that work directly with the communities. They're not working through the media. They're not working through a press release to reach an affected community. They're actually working with the community and in the community and developing products that will be posted in the clinic or sent out on SMS very directly to the community. But the public information officer, if you think of it as a media officer, the focus is very much externally. Are there any questions on that? Galaxy A8, I don't think your question could be on that because your hand's been up the whole time. Is there anybody who'd like to raise their hand? Are there any questions on what I've just presented there? It looks like it's Galaxy A8. Could you please introduce yourself when you're unmuted?
Hello, everyone. My name is Bode. I'm speaking with you from Nigeria. The question I have on the community engagement officer is that, is it right to say that the community engagement officer will collaborate to get feedback from community upon which an action plan will be drawn out on the way forward to better the lot of the community versus just a straight and direct way of communication to the community? I want to, in my personal opinion, I want to see the community engagement officer as someone who is in operation with the community, who understands the needs and the scope within which the engagement framework is established, and then action plans, collaborations take place.
So you've described the role of a community engagement officer, which is different from the public information officer. And definitely the public information or media relations officers need to work very closely with the community engagement officers. I'll give you an example of that. When I worked in DRC on the 10th outbreak of Ebola, I was stationed in the country for a certain period of time to support the public information officers that were already within the IMST, within the country. And let's say there was vaccines have arrived for Ebola, and the community, we want to be sure that the community is open and ready to receive these vaccines. So of course, as a public information officer, you would encourage the incident manager to do interviews about vaccine safety. You would do a press release working with your logistics colleagues to say how many vaccines have arrived and that they will start to be used. You would want to work with the Ministry of Health. I'm speaking from a WHO perspective, but many of you are already Ministry of Health. You would want to work with Ministry of Health colleagues and see if the Minister of Health himself or herself would like to talk about vaccines and Ebola vaccine safety. In terms of working with the communities, with the villages where the vaccination will start, that's what the community engagement officer will do. They will actually go into the community. They will hold meetings with community leaders to understand what people's worries are. So that's what a community engagement officer does. The public information officer will not be going into the community and doing that work. You're working on the broader work, the media engagement, making sure the broad public understands vaccines, which is different from the very focused work of a community engagement officer. I hope that helps to clarify a little bit. So,
Nika, we have a question, a couple of things in the question and answer.
yes.
One from Elaine. Could you please elaborate more on the role of the public information officer and information sharing with external entities? He said he was really thinking that it is not the role of the PIO to talk or disseminate the messages, but the communication officer. So it's an interesting topic of discussion.
Yes.
So
in fact, the communications officer is the public information officer. There's different names and different titles. And of course, depending on the incident management structure that you are in, you'll have to clarify. But yes, the public information officer could be the spokesperson. The public information officer, another title for that role is communications officer. That's different from community engagement. I say that because in some of our country offices, WHO country offices, they're very, very small, and one person may be responsible for all of those roles. But when you're in an incident management structure that has been set up, the public information officer is responsible for your external communications. So I just have a few minutes left. So I'll outline, for example, in the COVID response that I am the public information officer for, in the incident management system at headquarters. I am responsible for working with leadership, including our Director General, preparing him for press conferences so that he knows what type of questions he's going to get and some suggestions on how he might answer them. Of course, he has his own views and we'll go with those, but we present him with the current issues that the media are asking about and some suggestions on how he might answer them. Similarly, I work closely with our spokespersons and share the same information with them. What is the incident management system working on? What are we concerned about in terms of epidemiological figures? Is the outbreak increasing or are numbers starting to go down? And what can we say publicly? That's what the public information officer can share. So one of the products I develop and that I work on all the time are called Media Talking Points. And that is a document that outlines the key information that we can say to the public, that we could put in a press release, that we could say in an interview. So all of that key information about the outbreak or the incident. And then we usually list the kinds of questions we expect to receive from media and some suggested answers. And that document, that Talking Points document, I will develop because of all the meetings of the incident management team I'm part of, and I can hear what's changing, what's important, what do we need to highlight to the public. And I will write up that document, and then a technical colleague will clear it. Sometimes they'll make it very technical and I'll work on it again and simplify it. And then it needs to be cleared by someone in leadership. It often would be the incident manager themselves. If they're too busy, they might assign an officer who can clear talking points. So that's really one of the key products that comes out of the public information officer is talking points and guidance on how to talk about the various issues. You may be responsible for writing press releases, as I mentioned earlier. There's a small difference depending on where you are. If you see the guidance from AFRO, the public information officer is responsible for writing situation reports. In other contexts, it's the information manager or the data manager who writes situation reports, because situation reports can take up so much time that you won't have time to manage media questions anymore. So that's why the public information officer, depending on the setting, may not be responsible for situation reports. I mentioned that one because that's a very key product that takes a lot of time, and that often leadership might assume that the public information officer drafts the situation report. But if you do, you may not have as much time to answer media questions, and media questions are key. How does the world know how this situation is evolving? How does anyone in country know how the emergency is evolving if you haven't spoken to the media? So that's why the public information officer role is so key. You also work very closely, I do in the incident management system, with other colleagues. For example, the US Centers for Disease Control has an information center, and we work with them as well. UNICEF has communications officers that we work with closely. In fact, UNICEF and the Red Cross have focal points within the incident management system that we work with extremely closely. So you're working with media relations colleagues from other agencies, and in your case, I would imagine from other parts of government. If you are working on a flood, you may need to work with colleagues who are involved in the Ministry of the Environment. If the outbreak or the emergency affects children, you may need to work with the Ministry of Education. So the public information officer will work with public information officers or media relations officers from other ministries as well. Other stakeholders, you need to work a lot with leadership, as I mentioned earlier, with the head of your organization, so that you know what their political priorities are and what they're concerned about. You may need to work with public information officers within your town or province or region so that you can align all of your messaging. And that takes me back to the product I mentioned off the top, the media talking points we share with other communicators at other agencies or in other geographic areas, so that everyone can be using the same reference document when they talk to the media. So really the media talking points for me is a key product, and drafting press releases or setting up interviews for colleagues. It's all around media, media, media. So if you come away from this session, the one key word to remember is media. The public information officers, one of their main jobs is to summarize everything that we're allowed to say to the public, and that is say to the public through the media. I think that basically wraps it up from my side. And if you want to look at the very specific details of how you structure that and what products need to come out and who you need to liaise with, if you want to see the details, please have a look at those resources I mentioned off the top. Those are your key reference documents.
Thank you, Nika. So we have a couple of comments. One, I think that goes back to what we were first discussing, just somebody commenting on what they think the sort of basics of what communications is in emergencies, and that's from Ching Yuan Pang. Apologies for my pronunciation of names in advance. Talking about providing accurate, consistent and correct information to the public on the situation, as well as sending out the correct messages for the public, so as to dispel rumours and combat misinformation. And 3, to educate the public and media on the actions required and how they can effectively work together to carry out community mobilization. So that's, I think, just in answer to your question at the very beginning about what communications in emergencies is.
And that one, just to unpack that one a little bit, if you were to do that work, and that's exactly the kind of work that needs to be done. To do that work well, you have to work very closely with your risk communication colleagues and your community engagement colleagues in order to craft the message in a way that people will understand and make sure you're reaching them the right way. Sometimes our leaders might assume that if we've said this on the radio, if we've done a press conference about this, the public is informed, but you often need to work with your community engagement colleagues to really focus that message and reach the public where they are. And that wouldn't be for you to do through the media, that would be for those colleagues to do more directly. But that's a very good outline of the work.
I think one of the clear kind of consistent themes that comes through is that joint approach, isn't it, in terms of communication and making sure that there's that consistent approach by everybody. Everyone's aware of the information and things that came out quite strongly in your discussions. We have another few questions coming in, so thank you to everyone that's posting questions. So we've got another probably about 3 minutes to answer these. So
don't want to cut into Jamila's time, because she's going to be, you'll learn a lot from her presentation. She's going to touch on a lot of what we've discussed and go into detail of a country experience. So we could also hold questions until we've seen her presentation.
I'll just do the first question then from Benedicta Boma. What are some of the major media strategic tasks these stakeholders use during emergency preparedness?
Emergency preparedness. So that's a good point. One of the things that we can talk about when you're not in an emergency but preparing, that's a good time to do training. That's a good time to work with your colleagues who might be in a position to be spokespersons and ensure that they've had communications training. Another good thing to do is to make sure you have your communications plans in place, so that when an emergency hits, you might know what you need to do within the incident management structure, but what about all the other communicators you need to reach? Are you already engaged with them? In fact, do you already work with your regional and provincial and national communications focal points? Do you know their names and phone numbers? Do you have a list? Are you in regular meetings with them? So the time to begin, the time to build those relationships that you need is before an emergency. Of course, you will build them very rapidly during an emergency, but everything will move much more smoothly if you already have that relationship set up. So in quiet times, that's the time to set up regular meetings that helps you identify who the people are. You can start working on emergency communications plans. And the process of agreeing on those plans brings everyone together, brings in ownership, and already shows you what some of the difficult points might be when a real emergency hits. So the preparedness, I would say, the preparedness phase is when you need to identify your stakeholders and engage your stakeholders together on developing a plan so you're ready to go as soon as an emergency hits.
Great, thanks, Nika. I got another. Got time for another quick question. So from Anonymous. So someone's asking, saying thank you for the presentations. I think they want to just understand a bit about how Indigenous people are, I guess, considered in public communication at the community health and well-being in an emergency situation.
So that will be another time where I say that you would learn a lot from your community engagement colleagues, because they will be working more closely with many subgroups of the population, and they would be able to advise you on how to best reach those audiences. I would think that's work best done because it needs to be targeted, because it needs to be in local languages, because it needs to be adapted to the knowledge, attitude, and perception of those specific communities. This is really the kind of work that your community engagement colleagues could do best and can advise you on. You are making me think, though, of one of the things I haven't mentioned yet, which is the importance of your communication being in the language that people need. If you're doing everything in English and your country has half the population speaks French and another 10% doesn't speak French or English and speaks another language, you have to make sure you've adapted your communication to reach them. Perhaps your government language is French, but to reach the sub-communities, you could make sure that your leadership does some radio interviews with local radio stations. And again, work closely with your community engagement colleagues to see where you should best focus your energies to reach everybody.
Great, thank you, Nika. So I think now we'll go over to our second speaker, who's Jamila Ibrahim. So Jamila joined the World Health Organization in 2015. as a communications officer for WHO. She's responsible for strengthening communication efforts on the results and impacts of assistance from WHO in South Sudan. Building and strengthening relations to national and international media represented in South Sudan and facilitate their access to relevant and timely information about the activities and results of WHO. So before joining WHO, Jamila spent over 12 years with the UNOCHA, serving the humanitarian arm of the UN Secretariat. Jamila's international experience includes, among others, working with UNOCHA in Eritrea, Yemen, and with WHO in South Sudan in various capacities. Currently, she co-chairs the UNCG and is coordinating the implementation of the UNCG work plan as well as the UN local vaccine deployment communication plan. So Jamila will be taking us through the communication in role in context of South Sudan. Over to you, Jamila.
Thank you, Amy, for the brief introduction. As I said, my connection is not stable, so I will not put on my camera. I don't know if Chimwa, one of you, can project also the presentation because I'm seeing a signal. My signal is not as good as. Thank you. Thank you so much. Yeah, I will just try to explain. Actually, thank you, Nika. You made my life easy. I will take you through our country experience, specifically with a focus on COVID-19, the external communication activities in South Sudan for the COVID-19 preparedness and response. Next slide, please. So just to give you an overview of the priority areas of work in South Sudan for the COVID-19 preparedness and response was the overall coordination. We have an incident management structure. We have an incident manager from the Ministry of Health, and we also have an incident manager from WHO who co-chairs and coordinates the overall COVID-19 response. So the different priority areas in South Sudan are risk communication and public engagement, case finding and contact tracing, surveillance, public health measures, laboratory case management, IPC, and societal response. These are the priority areas for under COVID-19 in South Sudan. The COVID-19 emergency response strategy, the communication strategy, our communication strategy is to ensure that health authorities, policymakers, and the public are updated about known facts and the guidance. We also tried, next slide, please. We also tried to document the preparedness and as a communication team, the preparedness and response activities, both by WHO, because I'm a WHO staff, sorry for that, and of course, partners to ensure that people have confidence in WHO as well as the public health sector during this critical time. And the external communication team also supports the risk communication because we work together to ensure that we send the right information to the decision makers for an informed decision making. So we support the risk communications by ensuring that we disseminate critical health information using traditional and social media. Next slide, please. Yes, thank you. Yeah, during the preparedness phase, South Sudan reported the first case on 5th of April 2020. So before that, what we did was, as part of our preparedness strategy, communication strategy, was we immediately, based on the information that we got from headquarters, from WHO headquarters and regional office, we tried to develop and design accurate information, and we also tried to actually share that information to raise awareness on COVID-19 and the risk, symptoms, and prevention. And initially, as the first, in addition to that, the first activity that we implemented during the preparedness phase was to actually organize a press conference led by the Ministry of Health And, you know, in South Sudan, we have a big UN community, and it was the first press conference was actually led by the Ministry of Health from the government side, and from the UN side, representing all the UN as well as the humanitarian partners in South Sudan was the deputy resident humanitarian coordinator, who is the deputy special representative of the Secretary General. So we also immediately, using the available resources, what we did was we tried to train our journalists on COVID-19 risks, symptoms, and prevention. And we also organized some kind of talk shows and interviews. If you can see, as you can see in the social media, some of our social media posts, these were some of the activities that we implemented during the preparedness phase. And that training actually, initially, we, as WHO, for example, we received a lot of requests from the media. So it was very important under that incident management structure. It was very important for us actually to inform our media colleagues on whom can they talk to about what. So we have actually shared this with our media colleagues. So for any information related to national efforts as well as epidemiology, when we receive a request from the media, we direct them to the Ministry of Health if it is about epidemiology and the trusted health source on the disease. WHO takes that responsibility and talks to the media. And if it is, as I said, the UN, the Deputy Special Representative for Secretary General. Sorry, next slide, please. Yeah, the Deputy Special Representative of the Secretary General is the one who coordinates the humanitarian response in South Sudan. So anything related to the UN support to the national efforts goes to redirect the to the Deputy Special Representative. And we also, as I said, we have a bigger UN community. So we have the SRSG, who is in charge of the UN internal preparedness activities. So we used to actually direct our media colleagues for all internal UN related preparedness activities. But sometimes also we as UN agencies, we also respond to media requests or questions from our media colleagues if it is specific to specific questions, when we receive specific questions related to agencies. For example, if it is on border screening, IOM is the responsible agency. And if it is related to risk communication, for example, UNICEF is the colleague, so we direct the journalists to our colleagues in UNICEF. Next slide, please. Yeah, so during the response phase, our main communication activities were to reinforce our external communication. So to reinforce our external communication, what we did was we identified audiences and their communication needs. Then we developed, based on that, we developed a communication plan, and then we started now distributing talking points, developing and distributing talking points, press release, Q&As, and lines for proactive and reactive media engagement. So we also respond on timely fashion to any media requests, because it was a very key issue and people were, the knowledge that we all had was very little. And we continuously conduct like press conference, at least once in 2 weeks. We used to organize press conference at least once in 2 weeks. We produced also public service announcements for broadcast on radio. We have, as I said, we have a big UN community in South Sudan. We also have a UN radio. So Radio Miraya is a UN radio. It has a wide coverage and it's free. It was easy actually for all of us to use Radio Miraya to actually reach out to the community, the general public in general. And yeah, so we also facilitate the WHO and other health experts for interviews, panel discussions, and current affairs, programming them in broadcasting on Radio Miraya mostly, and of course we also use other media outlets like iRadio and other media community radios. And in collaboration with other partners also through the incident management structure, we also try to come up with social media products, including sharing infographics, short videos, and other key health messages. And during the response phase, it was also very critical for us to strengthen our strategic partnership with partners. So what we did was within the UNCG in South Sudan, we have a UN communication group. Within the UN communication group, the DSRSG actually formed a task force within that to lead the work on behalf of One UN, of course, to support the national-led efforts to prevent COVID-19. And of course, to prepare for COVID-19 by working with the government of South Sudan to disseminate public health information if required. Then we also, South Sudan reported the first case in April 2020. So since then now, we were in a lockdown, so we need to come up with a strategy to train our journalists. So what we did was based on the information that we have in collaboration with the UN Communication Group, using the resources from the UN Communication Group, then the ministry and the UN Communication Group came up with a strategy to develop a training material. So the training material was actually produced in a form of a short video for different sessions. And then we created a WhatsApp group, and we used that WhatsApp group actually to train our media colleagues on the basics of COVID-19. Of course, into that, we were also holding regular engagements with partners in joint actions at various levels. For example, like with UNCG, with AMDIS and Internews. Next slide, please. Yeah, so, towards mid-2020, we also came up with a media plan, and we started working with UNESCO, the Association of Media Development in South Sudan, AMDIS, and the Ministry of Health. We established a media desk at the Ministry of Health, actually under that incident management system. So the media desk was established at the Public Health Emergency Operations Center. So we then conducted a media monitoring for stories on COVID-19. Then based on that, we conducted also an informal survey to find out the needs. And we provided a list of questions to prepare colleagues from the Ministry of Health and the WHO for the media briefing. So we contacted the key media house in South Sudan, VOA, Juba Monitor, and so on. I don't want to go to the list of media houses that we conducted. So we started working with UNESCO and AMDIS also to orient and train journalists covering COVID-19. This is apart from the video training, the online training that we conducted using our WhatsApp group. And we also, as public health officers or external communication officers, we also tried to support the risk communication and community engagement technical working group through providing updates on what the UNCG task force is doing on external communication. And we also try to collect information, especially through the rumor tracking tool. The risk communication and community engagement technical working group has a rumor tracking tool. So we use that the information that comes from that tracking tool to develop actual talking points for MOH and WHO. And they go to the media, especially during the weekly media briefing, to update the general public using the different media outlets that we have in South Sudan. Next slide, please. Yeah, these are some of the key achievements from our collaboration with different partners during the COVID response in 2020. And one is the establishment of the media desk at the Ministry of Health. That was very important. Up to now, we are having our weekly media briefing on Sundays from 12 to 1 p.m. Sometimes it goes up to 2 p.m. just to update our media colleagues on what is going on in regards to COVID-19 response. It's not only about the COVID-19 response in South Sudan, but the global and regional. We also provide the global and regional overview of COVID-19. So in 2020, we also provided a training for about 90 journalists in collaboration with UNESCO and AMDIS, as well as other partners. As part of the incident management system, the challenge in the Ministry of Health, we don't have a focal person for external communication. So mostly WHO provides that support. It's obvious because WHO is a secretariat, so we provide a secretariat support to the Ministry of Health. But of course, it was very important also for the ministry to have a website and a social media page. So what we did as part of that support under that incident management system was the incident manager identified a focal person who will be managing the social media page for the Ministry of Health. And of course, later on a web page has been developed. So we actually established a social media page for the Ministry of Health and the website. So the ministry now on regular basis provides an update using the different platforms. So the weekly media briefings, for me, one of the key achievements from our COVID-19 response, because that is the only actually regular forum that we usually use to interact with our media colleagues, including the recent, for example, last week we received the COVID-19 vaccine. So we use that forum to inform our media colleagues, and we also use that forum actually to provide at least an orientation session on COVID-19 vaccine, and that really also helped us to get a pretty good coverage of the reception of the COVID-19 vaccine last Thursday. And we also came up with a communication plan to develop, which is a media plan for the UN in South Sudan to support the UN external communication plan developed by UNCG task force for COVID-19. Currently, actually, we are working with on external and risk communication activities together with the UN and other partners to roll out COVID-19 vaccine. Next slide, please. Thank you. Yeah, so, sorry, that is 2020, not 2019. So in 2019, apart from the two face-to-face trainings that we conducted, at the end, we also, in collaboration with the Risk Communication and Community Engagement Technical Working Group, we came up with a bigger package of training to actually train about 30 journalists in South Sudan, in Juba, those journalists based in Juba, and a larger program also developed with other partners like UNFPA, AMDIS, UNESCO, Internews, and some NGOs to enhance the skills of our media colleagues on reporting on health issues, and particularly with a focus on COVID-19 as well as ethical reporting. So that's the bigger session. Actually, we managed to train about 60 journalists in Juba, and plans are actually underway to train some journalists outside of Juba. So the support to the risk communication and community engagement is also our key achievement from our external communication support under the incident management structure. So we are actually like WHO, for example, WHO and UNESCO, UNDP, we were co-chairing the media engagement subcommittee and linking the media with agencies, with partners for the Ministry of Health. Thank you so much. That's all from my side.
Great, thank you, Jamila. Brilliant presentation there. I think we've got some time now for some questions. We've got quite a few questions actually in the question and answer box. And what I will do is try and combine some of them because some of them are along the same sort of theme. So I've tried to combine some questions for you. So hopefully, if you're able to answer these, Jamila, and I don't think is Nika still on the line that we might be able to help with answering. Hi, Nika. So I think the first question that's been asked a couple of times is around the sort of knowing the efficacy of your communications and knowing how effective they've been. So there was a couple of questions about that. How do you know when your communication has been effective and reached the communities that you have needed?
That would be for Jamila, I think.
Jamila, you're on mute.
Sorry, I was muted. Yeah, what we did last year, for example, was we tried to conduct a media monitoring for stories. We also conducted an informal survey with some of our media colleagues. As I said, the Association of Media Development in South Sudan we are closely working with them. So we do our survey actually in collaboration with the Association of Media Development in South Sudan. So that's how we actually monitor the effectiveness of our communication.
Great, thanks, Jamila. Nika, have you anything to add to that question?
We do the same thing at headquarters. We do media monitoring to see, for example, if we've done a press conference, what was the main message we wanted to get across, and then compare that with what was the main message that the media picked up. But that is not quite the same thing as seeing whether or not people's point of view changed or if people's behavior changed. And that's something that our risk communication colleagues do.
Great, thank you. I think the second sort of series of questions that have all come along similar lines is about how do you reach communities that are difficult to reach and you know, sort of specifically different sort of faith-based actors or religious leaders or communities that are difficult to reach in terms of access and things like that. So how is the communication getting to those hard to reach communities?
Can I come in, Nika, before you? Okay.
Please, you will know much more about this than me, please.
Yeah, you know, that is actually risk communication. It's the RCC, the risk communication and community engagement technical working group role. But of course, at country level, the external communication team works closely with the risk communication and community engagement technical working group. And what we did, for example, in South Sudan is, as I've mentioned in my presentation, we have a rumor tracking tool. And we also, what we did was we tried to set the key message. We produced some posters and radio talk shows and jingles in different languages to reach the hard to reach areas, to reach the community in hard to reach areas. But basically that is the responsibility of the risk communication and community engagement technical working group, but we work closely with them. Over to you, Nika.
I think you covered it really well, Jamila.
Great, thank you. Senia, did you want to come in, or was that? Did I hear you want to come in? If not, I'll carry on with the questions. So I think there was a question, a couple of questions around actually the communication officer role and that of the community engagement officer, and asking if there are any sort of training or legal requirements for appointing communication officers or community engagement officers.